evening, viewers. It's great to have you back. Tonight, I come armed with facts as coronavirus scare begins to peak in our country. Now, 16 Italian tourists and about 9 Indians have tested positive in just the last couple of days, taking the number of fresh cases of coronavirus to 25 in our country. Living rooms, offices, homes, schools, almost everywhere. And of course, on your WhatsApp groups, we're all seeing an overload of information on advisories and tips and what to do and what not to do, and conversations about what really works, home remedies, medicines, vaccines. So tonight we've decided that on the debate, we'll bring a panel of experts who can help us separate fact from fiction. Give us the facts, give us what we really know, information that we can use to help prepare better, to be safe, and not fall for all the myths that are doing the rounds. There's lots of myths that are doing the rounds, lots of false information, lots of fake news about coronavirus. My team has also compiled about 23 common myths. They're not all, but the most common ones that perhaps you've already got on your WhatsApp that are doing the rounds. So we will tell you about these 23 myths. We will bust these myths for you. We will get our experts to give us more insights into it. Our phone lines are also open. You can call up, speak to our panelists if you have a doubt about coronavirus, whether it's prevention or cure or treatment, or simply boosting your immunity, how it spreads, how can you be safe. Any of those questions, our experts are here. Now, we've divided these 23 myths into different categories. And I want to start with the category of prevention. Myth number 1 in this category is hand dryers are supposedly effective in killing coronavirus. And this one even I got. Somebody actually sent it forward, says, well, you know, hand dryers are actually helping kill the virus on your hands, so you should do that. Fact is, the only way to have clean hands, to not get any kind of infection, is to wash your hands regularly with soap and water and dry them thoroughly. There's another myth which says UV disinfection lamp can kill coronavirus. Fact is, UV radiation can cause skin irritation. Your skin really shouldn't be exposed to any kind of UV rays. There's another myth which says thermal scanners can detect coronavirus. Well, thermal scanners can actually detect a high temperature. So if you have fever, that can be detected. But if it's coronavirus, no, not specifically. There's another myth which says products that have been imported from China, all these electronics or other personal use products, or even holy colors that are being brought in from China will carry the virus, and that's what's infecting you. That's what's infecting people in Italy. Fact of the matter is, coronavirus really doesn't survive on surfaces and on objects for too long. There is a shelf life issue. So it's highly unlikely that if you're getting an electronic from China, that's going to give you coronavirus. Myth that pets can spread coronavirus. No, there is no such evidence that suggests that pets can be carriers of coronavirus so far. Nothing specific than what you and I can actually have. This is what set number 1. Let's also say good evening to our panelists. And over the next 60 minutes, I'll bring you more FAQs. I'll also bring you more myths, and we'll bust those myths for you and give you some more facts. And if you have specific queries, our phone lines are open. Let's say good evening to Dr. Arjun Dang, MD Pathology and CEO for Dr. Dang's lab. Dr. Prashant Chajjar, Interventionalist Pulmonologist and Director for Lung Care and Sleep Center in Mumbai. Dr. Sanjeev Bagai, Padmashree Awardee and Chairman for Nephron Clinics. And Dr. Sanjeev Mehta, also a pulmonologist, joining us this evening. Let me go across to Dr. Bagai first. Dr. Bagai, I just listed out few of these myths. There are lots more, and we're getting lots of queries as well because people don't know what to believe, what not to believe. As far as prevention is concerned, what can we really do?
Hi, good evening. Just basing the discussion on pure medical facts, which most of the medical professionals will know. Coronavirus is by and large a mild disease. It doesn't affect children so far. It has a very low incidence of fatality under the age group of 50, And overall, the incidence of fatality in terms of a death rate is much lower than most of the other viral infections which we've seen, including H1N1 and SARS and MERS and so on. This is an infection which can be transmitted from one human being to another human being, basically through coughing or sneezing. The basic precautions which I will advise everyone to do is, first of all, is follow simple guidelines of personal hygiene, hand hygiene. In this, do not go running for an expensive alcohol-based hand sanitizer. A good 20-second to 30-second hand wash from the front and the back of the hand and in between the fingers under running tap water, and dry the hands thoroughly is more than sufficient. Do it frequently through the day. Do not take unwashed hands to the eyes, nose or mouth, because this is something which can transmit through the oral mucosa or the eye mucosa or the nasal mucosa. This virus has an incubation period between 9 and 14 days. You need not have a fulminant fever during the incubation phase, so you may be an asymptomatic carrier. If you have any symptoms of either mild fever, body ache, and anything can precede another, or a cough, show the local doctor. The only medicine which is safe to take is paracetamol. As far as medication is concerned, there is no proven medical science-based, evidence-based medicine for prophylaxis. That means to prevent. There is no known treatment as guidelines, and there is no vaccine. The best we can do is to hydrate ourselves well, eat well. There is no need of overpumping ourselves with vitamins and nutrients and various kinds of medicines which are being promoted through what we call as a WhatsApp university. There is no need to take any home remedies. The safest thing to take is paracetamol if required. Keep away from people who have a cold or a cough at least a distance of 1.5 to 2 meters, that's 5 to 6 feet. Cough etiquette is important. Don't cough out. In case you need to cough, cough into your handkerchief. If you have yourself as an index person a cold and cough, try to isolate yourself at home, not only to prevent yourself and keep yourself well, not to transmit this to other people, if at all you have a coronavirus. Coronavirus otherwise is generally a mild infection. It has a very low penetration as far as death rate is concerned. So clearly the message is do not panic. In the end, the last point which I would like to mention is there is a huge furore over face masks. Face masks are not routinely prescribed. We see a lot of people in Delhi just on the streets walking around with face masks in my office, in the clinic. Now, face masks are of two types. One is a surgical mask and the second is an N95 mask. A face mask also is not routinely required unless until you have a cold and cough. You may wear it only to prevent this infection or any other infection going to any other person. The N95, the superior mask, is only meant for healthcare professional workers who are coming in very close contact with patients in ICUs or who are on a ventilator, who come in contact with secretions. So my advice is please do not go running after masks. You will actually have a short supply of it in the market, and the people who actually need it as the healthcare professionals may not ultimately get it. My final message is that this is a mild infection. This is a new infection. It is going to evolve. Hopefully with the oncoming summer months, the infection is going to go down. How it is going to behave, that means in terms of probability of whether it will become like a seasonal flu or whether it will become a primary and going on to a secondary disease, we'll discuss this as the program rolls on.
Yes.
I think time is going to tell. But the final line which I would like to mention is no need to panic.
Yes, and that's extremely important, and we're also repeatedly telling our viewers there is no need to panic at all right now. Dr. Dang, Dr. Bagai mentioned masks, and that is not so essential. We shouldn't be panicking and running to a nearby store to stock up on hand sanitizers or masks. How important is hand sanitizers? Today I had somebody, mention this in our office itself, saying, well, hand sanitizers are essentially, we were told they're antibacterial. How does it help fighting any kind of virus?
Sure. So first, I'll just add to Dr. Bagai's point on face masks. So face masks, like Dr. Bagai said, are only essential for someone who has symptoms or someone who actually is taking care of someone who's suffering from coronavirus, such as healthcare workers. But the most important part also, apart from this, is if someone has symptoms of flu and is wearing a mask, then what is the actual correct way of putting on the mask and then taking it off? So when you put on a mask, you are not supposed to touch the front of the mask. You're supposed to orientate it in the correct way so that there is no gap between the mask and your nose and your mouth that it covers. Hold the strings on the side and tie it at the back. Now, you're not supposed to touch the mask with your hands. So the mask does protect you. Suppose someone's having cough. So it will protect the people around them. But the mask also acts as a barrier so that you don't keep touching your hands to your nose and your mouth. Also, if the mask gets damp or wet, immediately discard it. Single-use masks should not be used again. And also, while discarding it again, go to the thread at the back, unfold it, put it into a dustbin that has a lid on it. So that is extremely important while using masks. Apart from that, hand sanitizers, yes, definitely, again, like Dr. Bagai said, washing hands with soap and water for 20 seconds is the best technique. But obviously, suppose you're somewhere where you don't have access to soap and water, then alcohol-based sanitizers, 60% alcohol-based sanitizers is what is being recommended, and they should be used to clean your hands.
Oh, all right. But what do we do, Dr. Dang, if hand sanitizers are not available, which in many cities now has become the case? Is that a cause for any kind of panic?
Not at all. So hand sanitizer is only secondary to soap and water. So when we have access to soap and water before touching our face or at frequent intervals in the day, soap and water is a better alternative to hand sanitizers actually. So there's absolutely no panic situation if there are no hand sanitizers available.
So hand sanitizers and masks are not the beginning and end of your prevention or precaution steps. There are lots more that you can do. At the end of the day, it's as simple as as basic hygiene. And what we should any which is be doing, ensuring our basic hygiene, regularly and frequently washing our hands with soap, and if of course available, alcohol-based sanitizers.
So can I add one thing regarding the masks?
Yeah.
Yes. So basically what this issue around masks is now doing is we need to control the consumption of masks, and like Dr. Bagai also said, only the people who have symptoms or healthcare workers should be using them, because what it does is it reduces the supply in the market, is an extra cost also, and thirdly and most importantly, someone who doesn't need a mask and is wearing a mask gives them the false impression of security or safety, and then they don't follow the usual hand hygiene and personal hygiene that is of paramount importance compared to masks or anything else.
All right, I want to now move on to the second set of myths that we have actually put together, and these are more to do with the kind of food you can eat or shouldn't eat or should eat, and will help you what you're consuming. For example, and this is the most, by far the most bizarre one I have heard, but I just want to put it out there in case anybody has any confusions. It's a myth. If somebody tells you that eating Chinese food is dangerous, no, it's not dangerous at all. It's not really coming directly from China this very minute, carrying fresh viruses on it. So it doesn't really infect you in any way. It's not harmful at all. The other myth is turmeric milk can help cure coronavirus. In fact, there are a lot of these instances, and we'll go into details in just a bit. Some of these home remedies can only help you boost your immunity. It's what you would do if you want to boost your immunity and fight any kind of infection better. It doesn't mean that it can cure coronavirus. There is no evidence that suggests that haldi doodh peene se coronavirus theek ho jayega. This one I'm sure a lot of you have heard. One peg of any kind of alcohol and directly consuming that alcohol is going to help kill coronavirus. There is absolutely no evidence that suggests that drinking alcohol fixes this problem. Neither is there any evidence right now that suggests that consuming substances like weed will help fix coronavirus or cure coronavirus, essentially speaking. Eating garlic prevents coronavirus. This is another myth, and I'm sure in our WhatsApp family groups, some of our relatives have already sent this to us. No evidence that proves that eating garlic will prevent coronavirus. There's another myth which says non-vegetarian food altogether is dangerous and will infect you. don't eat chicken, it's going to infect you. There isn't any evidence to say that non-veg food spreads coronavirus, or if you don't eat it, you will be all fine. That also doesn't work. I don't know, can we, are there any other such myths, Dr. Prashant Shajar, that you've come across? Are there is there anything that we should not be consuming or eating at this time?
I mean, other than the eating, some of the phone calls that I have received are, people are getting parcels from Middle East, from Southeast Asia. The question is, should we be opening the parcels? Should we be opening the envelopes at all? And I think that's another myth. So I think the virus does not stay on the surface for so long when if you get a parcel or something that has come through a courier. So that's I've received a few phone calls for that as well. From the food point of view, I agree with you. I think all the points which you've discussed are clear myths, and I think we should not be worried about it at all.
All right, thank you so much for clarifying on that part, because we've actually got lots of these homemade remedies that everybody's forwarding. There's one actually just before the show started.
There is no
I got
evidence.
one which said that if you have hot water with lemon, and even if you have to go to crowded places or you have to go to your office, don't worry, just keep some lemon with you and drink some hot water with it, and you'll be fine. What could possibly even be the logic behind that?
No, there is no evidence. There is no evidence. No, I think there is no logic. I think these are all the myths which are being circulated on WhatsApp. People have some of these home remedies in which they believe will potentially help with viral infections. So I think there is no data, no evidence to say that these would help. One more thing is that people have been asking me for vaccines. Will the routine flu vaccine help them against the COVID-19 virus? And the answer is no. The current flu vaccines available do not help as far as the coronavirus, the current corona novel virus that we are talking about. So from the food remedies point of view, from the home remedies point of view, I think it should not happen that people should be under the false sense of security that, okay, I've had some turmeric milk, I've had some warm water with lemon, and I will be protected. As was pointed out earlier, I think we need to make sure that we are following all the correct hygiene measures, correct preventive measures which have been recommended, and we need to stick to them.
Is there a separation and differentiation that we need to put out here, Dr. Sanjeev Mehta, for our viewers to understand that some of these things can simply be about boosting your immunity, but it cannot help cure or stop the coronavirus?
Absolutely. First of all, Tanvi, thank you very much for inviting me, and thank you very much for this extremely important session. I completely agree with you, and I think you've done a great job in busting all the myths, and I'm completely in agreement with you and my previous panelists who have dispensed all with the myths. Coming to what you just said, yes, I think if you look at the entire chain of the thought that we've had today, all these items which you mentioned in having are all of those that go in generally improving your immunity. There is, I would say, a bit of a myth with the hot water and lemon that vitamin C helps in fighting viruses. So that's been there for a long time. So maybe that was the origin of the vitamin C. Again, it's a myth, not proven. As far as food is concerned, as long as it is hot, as long as it is cooked, you're not going to get any infection from it. It's very safe if you have fresh, hot cooked food. Now, as far as corona is concerned, it is not known at all to transmit through food. Now, probably the origin of that myth came because it was supposed to have come, like the SARS, from some animal source in China. Again, far removed, far away, we don't need to go there. But that being said, I would say as far as we are concerned, one area which I think was not mentioned so far is prevention when we are near live animals. Not that you need to not go there, but in live animal markets, in slaughterhouses or abattoirs, if there are people there or who have been working, they are very well advised to increasingly wash their hands and make sure that they don't touch anything without cross-infecting. If you look at the entire chain of events, whether it is cough hygiene, whether it is avoidance, then these are just very sensible general measures. And I said this yesterday on your channel, I say that again. I hope these stay with our population, because that will prevent the spread of not only this virus, but all other viruses. And above all, it will hopefully prevent the spread of tuberculosis, which is a huge problem in our country. So cough hygiene is great. Avoidance with people who are coughing is great. And of course, if you have the virus, please stay in kind of a self-lockdown and avoid infecting other people. If you're the chief of your office, you have a person who calls in, be generous, tell him stay home or go to a doctor, of course. So good food, good nourishment, good hygiene. I think we are pretty much on a good track right now.
All right. So here is my next question then, Dr. Bagai, and let me come to you with that. There is also, a lot of misinformation about how long does this virus live. And, for example, if there are products coming in from China, are those products to be not used, thrown away, not touched? Or if somebody has been in an area, how long will the virus be on the surface at any given point of time? Help us understand some of these details.
Yeah. So as far as the coronavirus is concerned, it doesn't stay long outside the human body. So the human body is like a shield to make the virus replicate. So if it is on an open surface, mainly door handles, knobs, or railings, or tabletops, it's about anywhere between 8 to 10 hours, 12 hours. Some studies have shown up to 18 hours. It doesn't last for more than a couple of days. If it's in a very warm environment like a carpet, it may actually stay for a couple of days. But if any object or some parcel is being imported from any country, the virus is most likely not going to be viable or not going to live. So I don't think there is a huge issue with regards a parcel coming in. The cause really of importance, not of concern, is don't touch things and don't use unclean hands and put them in your mouth. I think that's a habit which a lot of people have, and that should be refrained. Do not put hands in unclean areas, like in malls, on the railing of escalators, or on the top of a table when you're going to a pharmacist, because that's a huge burden of carrying infection, not only viruses but bacteria. Just one point I would like to add with the previous speaker, Dr. Sanjeev, who's mentioned it beautifully with regards to nutrition and diet. I think this full concept of low immunity versus building up immunity is a huge myth. You need to have significant comorbid conditions to lower a person's immunity. It's not a switch on and switch off. So there is no known vitamin, no known nutrient which can be given to an otherwise normal, healthy child or adult, which can suddenly increase the immunity. So I think a lot of patients come and say that we can take vitamins and things like that. It's not necessary. It's a complete waste of money. Just give a normal diet. A vitamin is given to cover a deficiency. So if a patient doesn't have any deficiency, do not subject the patient to what we call as hypervitaminosis. And very often a prescription once given to a patient is a repeat prescription for many months and sometimes many years, because they feel a feel-good factor that I'm continuously taking a B complex or a calcium and things like that. Very often vitamin D. These don't work and should be kept away from.
The other thing that I actually wanted some more clarity, and because this has become a big news, a couple of days ago we had Dr. Mark Lipsitch, who's with the Harvard as well. In one of his interviews, he said that he thinks by next year, 40 to 70% of the world's population would have coronavirus. Now, does that necessarily mean that everybody will be unwell and sick and will have the disease, Dr. Dang, or does it mean that at some point we will all become carriers of this but may not necessarily harm us?
So basically, like what we have seen is that out of the 90-odd thousand people who are infected with it, a large number are already well. So, like the other panelists have also stressed upon, this is a mild illness, and someone who doesn't have a lowered immunity has been known to recover completely, obviously in rare cases where it gets fatal. So even if people get infected, as long as we have all the safety health measures that we take and supportive treatment, a lot of people have also been known. Actually, more than 50% of the total people who've been infected are well now. And obviously, they've been kept in isolation, have had supportive treatment, basic medication for fever, etc. But a lot of them are well now. So that is extremely positive news.
Yes, in fact, that's one of the other questions that often comes across, Dr. Chhajar, that when we are being told that there is no specific medicine cure or vaccine right now, how is it that so many people, and especially in our country, the first 3 cases that we had, which were in Kerala, all 3 of them recovered and were discharged from the hospital. So, how is this being cured?
I think this is, I mean, the standard treatment for this is supportive treatment. So when we talk about supportive treatment, as was mentioned earlier, is nutrition, it's hydration, and treatment of the symptoms which the individual may have. So I think the focus is on that, because as we know that there are no specific antiviral treatments which have been shown to be effective. The trials are underway, the examinations underway. So as of now, it is supportive treatment, because in a viral infection, patients can get vomiting, patients can get diarrhea, patients get aches and pains. So I think the symptomatic treatment, hydration and nutrition, these are the mainstays which would allow the individual to recover. So it's a supportive treatment at the moment. As far as, I would like to add, this speculation about 40 to 70% of the world population having this COVID-19. Well, these are speculations, these are projections which are made. And if you look at it, actually the percentage of people in whom it really becomes severe is less than 2%.
Right.
These are the current statistics. So let's see, as times evolve, we will know actually what percentage of patients actually get severe disease, and actually how much of them is fatal, as we have more data coming out.
Okay, let me see if I can go across to some of our viewers as well, and if they have any specific queries.
One thing.
Yes, go ahead. Finish your point, please.
Well, one more thing I would like to add is, just on one handshaking is something that can be avoided, and we can stick to our standard namaste when we greet our people. So I think that again is an important thing, because often people are covering their mouth with just hands, and not often every time people are carrying sanitizers or washing hands as much as we might encourage them. So I think avoiding a hand-to-hand contact is also an important thing, and I'm sure I joined in late, but maintaining a distance of at least 3 feet is extremely important.
Actually, on that note, if you can just elaborate a little bit more on this, because earlier in the evening also we had a few viewers who called to say, well, how does it spread? What should be, at what proximity can it spread? Because the cases where we've seen, for example, the one from Telangana, from Hyderabad, that was that tested positive. People in that bus were then, put under scrutiny. The Italian tourists who were traveling together, their driver also got infected and has now tested positive. So, at what proximity can this virus spread, and how?
So what is recommended right now is to maintain a distance of at least 3 to 4 feet amongst the individuals. So as a physician, if patients are coming to see me, then I think what is recommended is you keep a distance of at least 3 to 4 feet between the patient and the between 2 people. So that can reduce the risk of transmission. Of course, if it's a loud cough, violent cough, and if it comes onto the surface, you touch the surface, and then again, if every time you're not cleaning your hands, then there can be a problem, and that is one of the reasons why it is spreading across so fast. But at the moment, what we can do is, as was highlighted earlier, is frequent hand cleaning with soap, water, maintaining the cough hygiene, as Sanjeev mentioned earlier. The cough etiquettes, I think they are extremely important, and maintaining a distance of 3 to 4 feet, I would reiterate on that.
And we have addressed some of these points, but I want to just reiterate some of the myths that are in reference to the cure and what people are saying, what's myth and what's a fact that we know. Let's go through those as well. Vaccines of pneumonia protect you from coronavirus. No known vaccine, in fact, viewers, right now is there for coronavirus.
No.
There's a
Answer
lot
is
of
no. Yeah.
research and testing that's going on, but we don't have anything so far. The other myth that's doing the rounds is coronavirus only affects older people. No, the fact is that it can impact, and it is impacting people of all age groups. It's just that the senior citizens at that age are perhaps more vulnerable to it, and the number of fatalities in that age group has been higher in few places. Myth: cow dung and gaumutra can help cure coronavirus. No evidence to suggest that so far, but as is the case with these products and many other claims that are made about what they can cure, there is no fact or evidence available so far. Myth: antibiotics can treat coronavirus. We don't have any known established medicine right now that says yes, it will for sure cure coronavirus. Geeta is on the phone line. She's calling us from Pune. Good evening, Geeta. Go ahead, please.
Yeah, hello.
Yes, go ahead,
I'm
please.
calling from Pune. Yeah. Hello.
Yes, what would you like to say?
Yeah, I would like to say is what I want to emphasize here is that now since summer has set in, I always see these fruit juice vendors, no, sugarcane juice vendors and juice vendors selling in glasses. Why that has not been banned, I am really surprised. And nobody has ever mentioned about this.
Yes, in fact, Geeta, I would say that this is also one of those hygiene habits that we should all have ourselves, that maybe carry our own water, carry our own bottle, and not use those glasses, because it is possible that it will bring you all other kinds of infections as well. Thank you for calling. Captain Jakpal on the phone line from Rohtak in Haryana. Good evening, Captain. Good to hear you from you. Go ahead, please. What would you like to say?
After a long time,
yes,
that I have
after
an
a long time
opportunity to be on your show.
Yes.
You have very elegant, light, knowledgeable panel. I would request them. I myself been keeping a herd of few thousand cattle where the virus diseases used to visit us. One thing that I would request you, the morning newspaper. You see, if the vendor, the fellow travels from Delhi or all over, he delivers you the paper. It is a home delivery. We can tell the gentleman, please have your money. I shall pay you for the month, but keep me off. I'm watching mirror now. Secondly, hot food, give a rest to your fridge, because all these viruses can stay in a cold climate. Food habits will improve.
Yes.
Thirdly, don't be miser. Tell the poor people to keep the change, because it is flowing through currency also. And that poor fellow you don't know. So if some of these can be added to the list of your most knowledgeable people, I shall be highly grateful.
Okay, Captain Jakpal, yes, interesting what you said. Our experts have already spoken about eating fresh hot food and how that's always the best option. Dr. Mehta, do you want to respond to what else he is saying, the 2 points that he highlighted about newspapers that are being delivered and currency notes or coins?
I completely agree with him, because newspapers, it can be, but currency notes are the things that are most handled, much more than the tops of pharmacies and other places. So I think there is a big risk of transfer of other germs. So when you hold it, then wash your hands after you've counted your currency. I don't think anybody's going to give up on currency, but they can definitely wash their hands. What I'd like to do, if it's okay with you, go back to some of the previous discussions. One of which was that I think maybe one of the reasons why India has not had such a big attack of virus pandemics is maybe the heat. We are getting into the summer, and maybe that's going to affect the longevity of the germ. It is not going to exist for long outside the human body. So maybe we are going to be protected, but again, that is conjecture. So you asked about the distance to be maintained.
Actually, I did want more clarification on that, Dr. Mehta. This is still a conjecture at this point of time, because that's usually the behavior of various viruses, that they don't survive in hot temperature. We don't know for sure how coronavirus will react.
Yes, I think so. But if you were to look at the SARS, the MERS, and the previous kind of viruses that have been in the pandemic, the various flu viruses, they did not do very well in the Indian environment. And that's why we didn't get these really horrible pandemics and epidemics that you saw in the colder climates. So probably there is something there. Again, I don't have the science to back that. As far as distance is concerned, it's always good to be away from the source. Now, we generally say 3 feet because it exponentially drops as you go further from the person. But as you rightly said, if there is, and Prashant rightly said, if there is a vigorous cough, the cough can spread 30, 40, 50 feet. So that's the importance of cough hygiene. But there is really not a very well demarcated, established, safe distance away from the individual. Coming to your point about a lot of people getting infected, I think the whole world does go through the pandemics. They will happen. We'll develop the immunity, and that will be part of the natural history of humanity. We've always had it. We had the immunity, and all our panelists have said it's not a bad virus. It's not such a severe virus. So everybody's going to get it. You rightly said any age can get it. The older suffer more because of comorbidities.
Yes.
Coming back to the point that immunity is important. If you're old, infirm, have severe diabetes, cancer, anything that lowers your immunity limits your ability to fight it. So we don't have antibiotics, but we have our immune system that fights it. And that takes about 10 to 14 days for it to kick in. And the immune system develops the antibodies and completely removes it. We are not going to become carriers. We are going to get rid of it, develop the immunity, but that takes about a week or 10 or 15 days. After that, it's not going to bother you again. And that's the basis of the vaccines too. Unfortunately, we don't have a vaccine just yet. It's in the making. Hopefully in a few months, there should be some vaccines to help us fight this, this virus.
All right. That's the hope. And
But
like you
next year
said
there may
that,
be
gradually we will also,
Can I just say, can I add something?
Yes, yes.
Can I add something? Just to add to what Sanjeev said, I think the last point about the supportive treatment, about the body's immunity, etc. And whenever, it's a common thing. If somebody has a viral infection, you need to rest, you need to eat, and you need to drink well. So I think that's the important thing. Coming back to the temperature, about India being, we would really hope that it doesn't take off in India. The temperature might come to our support because there are certain suggestions that the virus would not survive above 30 degrees. And I think, as Sanjeev rightly said, the summer is coming in, and hopefully we can expect that because this is heat-sensitive virus, we should hopefully not have a lot of spread of this virus.
Well, India would have never waited so desperately for summers to arrive before than it will this year in that case then. And we hope it actually helps us for a change. Mr. Sridhar Rao is on the phone line and he's calling us from Hyderabad. Good evening. Go ahead, please.
Good evening. I'm Sridhar Rao from Hyderabad.
Yes, go ahead,
Thank you
please.
for the opportunity given. I have got 2 questions, sir.
Okay.
The first question is, India is basically Ayurveda based right from the beginning. So if some of the people from Ayurveda background, if they would have come on the panel, that would have been very good. Second question is, the thing what I am understanding is we have to wash our hands often. If there is any infection, that will be washed away. So the infection is going into the water. So that water is getting contaminated. That is my thought. I don't know how far it is getting killed there.
Okay, all right. Let me take it across to our experts. So 2 things. One, is there an Ayurvedic solution that we know of? And if the water, and can the virus really spread through water? Dr. Dang, do you want to take that?
Sure. So there are multiple kind of treatments, etc., that are being suggested by alternative medicine experts. But as far as I know, there is no scientific backing to any of these or no published literature. And none of these have actually been included in any of the guidelines by the WHO, CDC, or even the Ministry of Health. Any advisories, none of them include these. And second of all, regarding the water, again, there is no guideline that tells us not to wash our hands or the water is transmitting it. Primarily, as we've already discussed at length, this is a droplet infection, and it can only be caused when one person coughs or sneezes or a hand is infected and then you touch the mouth, etc.
All right. The other question that I had is, there is a lot of conversation right now happening about being in public places, or our Prime Minister and many other leaders have said that, well, let's refrain from maybe playing Holi and going to such mass events. What is it that we are avoiding at that point? If people do want to play Holi, if children do want to celebrate with colors, to what extent can they go? Dr. Bagai, would you like to take that point?
Sure. Sure.
Yeah. I think as far as the proximity to people is concerned, the general advice is that a very large crowded gatherings, if can be avoided, should be avoided. Cluster of populations such as airports, railway stations, closed door environments such as train compartments, or indeed even aircrafts. If it is absolutely mandatory to travel, then travel. Now, in a festival like Holi, you may be having a very close person-to-person contact, which probably is a risk factor. Touching the hands, especially near the eyes or the mouth, it's a risk factor. But coming back just one step behind, to recapitulate one point which was being discussed earlier by all the panelists is that at the present moment, we really don't know how this virus is going to behave in the next 5 to 6 months. Yes, we know at the present moment it's mild and it's only affecting the elderly with comorbid conditions. The fatality is still very low. The virus may actually turn out to be actually a pandemic. It may turn out to be a seasonal flu-like virus. It may come year after year. We don't know whether the second attack, what we call as the secondary attack, if at all, is a reinfection of the person, whether the person would have a milder attack or indeed a hypersensitivity reaction. So these are questions which at the present moment we don't have an answer. I respect the fact that there are good lines in medicine like homeopathy and Ayurvedic and traditional medicine, but at the present moment, including allopathy, there is no known preventive medicine or no known vaccine. And at the present moment, even the treatment for patients is mainly supportive. So what we need to do is identify with a high index of suspicion, quarantine, that's extremely important. Search for the close contacts, extremely important. Mass screening with blood tests or swabs is not recommended. I think we need to go more on quarantine, isolation, identifying the index person, close contacts, and making sure that it doesn't spread. Now, ultimately, what will happen with this, what a particular person from Harvard said, is that X amount of million population worldwide, or 80% or 70% may get. This is a normal phenomena with most infections in which you develop what we call as a community or herd-based immunity. So when it is seeping into the population, there is a concept of what we know as a herd immunity. So over a period of time, a given set of population does develop immunity towards it. So it's not something which we have a crystal ball in our hand in which we can prophesize and give even a near accurate statistic of what is going to happen in the years to come. But at the present moment, to answer your question, keep away from very large gatherings where there can be a personal contact, especially in the eyes, mouth, and nose.
All right, Dr. Bagai, thank you so much. In fact, I just want to add to that about, what we can and cannot do, and what we said right in the beginning. I'm going to emphasize on this because I think people are still not getting the point. Sanitizers and masks are not essentially going to just simply solve your problem, and everybody needs to stop running after masks and hand sanitizers. Even as we speak, there are more and more schools which are actually asking the students to wear masks and come. And if everybody starts to get out there and start buying these masks, then you're probably not going to leave some behind for people who actually need them, especially in the field of healthcare and the medical professionals who actually need will need these masks. So let's not spread panic. Let's not jump the gun. It's a mild virus, as all of our panelists have been saying. Yes, we don't have a specific cure. We don't have a specific vaccine. But people have been known to recover from this, and that's what's essentially happened. Even in our country, the fatality rate is not so high. In fact, I'm going to take you through some of these FAQs just to broadly cover this information that you must know. Does coronavirus directly lead to death? No. The death rate is only 2 to 3%. Is there an anti-coronavirus vaccine? No, not right now. Scientists are working on it. Will there be a shortage of medicines in India? Well, the state and the center are saying that they're working on war footing. The reports that have emerged about shortage is simply because the basic ingredients are not we're not able to import some of them from China. But if we start panicking and start buying and stocking up in bulk for paracetamol, then perhaps there will be a situation which is not required at all right now. Should you be wearing a mask? Well, not really. They're not the ultimate barriers of saving you from coronavirus. What can you do to prepare for an outbreak in your area? Well, store some amount of water and food and basic medications and you're fine. You don't have to panic at all or go overboard buying these products. Should you cancel your travel plans? Well, it depends on where you are planning to go, just how crowded, but essentially the advisories: stay away from crowded places. You don't know who might be carrying the virus over there. Definitely don't go to China or to Italy for a vacation right now. Can kissing an infected person lead to transmission of virus? It could definitely infect you. Can having sex with an infected person lead to transmission of virus? Coronavirus are not known to typically be a sexually transmitted disease. Just some of the pointers that we've put together. Lots more on the other side. We've put the spotlight on just how ready is India, just how ready is our central government and our state governments, our hospitals, our lab centers and testing centers. That's going to be the next focus point. Stay with us on this special broadcast. Special thank you to all of the top doctors who joined us on the first round of conversation.